Hi, I'm Dr. Balasubramanian. This video clip is a result of seeing too many videos on diabetes in YouTube. Everybody talks and everybody approaches this problem in their own way. There is a reason behind this also. If a disease is caused by an organism, nobody will discuss on this because we know the cause and we know the medicine. You give the medicine, the organism will die. Enough. That ends the matter. But as far as diabetes is concerned, this has got a lot of reasons. We don't call them as reasons, we call them as risk factors. So people take one factor and they discuss about that factor in their own way. For example, it is concerned with food. So a nutritionist or a dietitian takes up this matter and discusses this matter in his or her way. That is why too many people talk about this disease. But one thing, it is not that factor alone this causes this problem. It's a contribution of various factors. The final outcome is this diabetes. Fine. So just I want to talk on this in a holistic manner, in the sense we should take all the factors into consideration and then how to prevent, how to control this problem, and how to prevent the complications. So this must be the approach to a disease which has got a lot of factors or attributes or risk factors. If you ask me a question, doctor, can you prevent death? Well, I will look at the person who is asking the question and whether worth answering this question. But to me, it's a good question. Well, no one can predict or no one can prevent death. That everyone knows. But people ask me for the argument's sake. What we do is we just prolong the life, the lifespan, and we try to prevent the premature death of a person with the little knowledge we gained by our education or qualification. That's all we are doing. I will tell that person, okay, I'll try to see that you die naturally by age process. My aim is you should not die because of diabetes or its complications. And we all expect that only. A life without any complications. That too, if it is preventable, then I would like to prevent it so that, or you will not die of diabetes or its complications. That is what we are trying to do. Is that okay? One thing is sure, you can decide and you can plan how to live, but how to die, nobody knows. When we will die, nobody knows. You can plan living and you cannot plan a death. Even a person who tries to commit suicide, till that moment, he was not sure that he is going to commit suicide. It's a momentary reflex action. The person takes a sudden decision, and even while doing that, at the last moment, the person will think, oh God, I have done a wrong thing. But too late for him to realize that that was a wrong decision. So suicide, even suicide, it's not a planned death. If there is a what you call a fate or destiny that this person should die of an unnatural death like this, it will happen. So you cannot plan that. So as a doctor, we are doing something to save you some disastrous outcome due to a disease. Now about this video clip, it is an attempt to wipe away some of the myths, preformed ideas about diabetes, and to assure you that diabetes is not a killer disease. You will not die of diabetes and its complications. If, yes, if. What is that if? Is it a big if or a small if? Definitely a very small if. That's what we are going to see in this video. Preventing a disease, curing a disease, reversal of a disease, remission of a disease. These are all some of the terms we hear nowadays, but all are different. Preventing, you prevent the occurrence of a disease. You will never and ever get a disease in your life. Example is a vaccination. We are trying on COVID this. We have done it on smallpox, polio. Only by vaccination we eradicated that dreadful two diseases actually. So that is prevention. Curing a disease, you are completely taking away the disease in the sense it is only for infectious diseases you can completely cure a person from that disease. He may get again the same infection, but you will cure him. An organism, that's an agent, a susceptible person, he gets the infection and he suffers from the disease, and you are giving a specific antibiotic for that particular problem. He is cured. The organism is killed and he is cured. This is cure. This is not possible in every disease or a disorder. So don't confuse with these terms like prevention, cure, etc. And of course, there is no vaccination for diabetes or blood pressure or hypertension. Disease and disorder are different. Mostly infectious disease, we call them as diseases. A disorder is something is not in order. For example, a very good example is diabetes, in which you call this as a metabolic disorder. So what we try is, we are trying to bring it back to order, from a disorder to order, either by treatment or by modification of his lifestyle. If you are given medicines, you call it as a treatment. If you are not taking medicine and you want to bring back to normal, you are modifying your lifestyle. When I say lifestyle, it is a behavioral change. That is what lifestyle modification. But remember, if you stop continuing that lifestyle modifications or behavioral changes, you are again going to go back to the original status, that you are going to get the same disorder again, because you are not treating it, but you are just controlling it, with not by medicines but with behavioral changes. Again, another word which many people use here is reversal. Reversal is not a cure again. If you really mean reversal, that means you have completely cured the disease, that the disease will not be there again, like what we do in infectious diseases. So reversal is not a cure. That is how many people talk in YouTube, that I have reversed my diabetes. No, it will come back again. What you do to reverse this problem? If you don't do that, or if you stop doing that particular thing, then again you will get it back again. This is also a reversal. The disease going back to normal, again you're getting the same disease when you stop doing a particular thing. This is also reversal. So reversal we can say it's a sort of remission. Remission means the disease goes into a dormant stage. It is not eradicated. It is not completely taken away from you, but it is in a dormant state. When a favorable condition comes for that problem, it will again come to you. So this is a sort of remission. That is what many people think reversal. So it is just modifying your lifestyle, a food pattern, activities, and you bring back to your sugar level to normal. And you call this as a remission only. It is not reversal because why did you get this problem? The possibility of getting this problem again, it is not taken away. It's a cycle. Reversal, you call it reversal, we call it remission. So don't confuse with reversal and remission. So instead of removing this type of ignorance and lack of awareness, many exploit this ignorance and make money. Many false promises, fake claims, magic drugs, miracle powders, herbal approach. How many people talk about this diabetes? Impracticable diet for a for a common public. A big paper is given in which there is list of things that you are supposed to do, the two in English. The person may not know even English, but he is given such an impracticable diet. Why? Why we fall a prey for all these people? Because of the false promise that they say that they can cure this disease. You are looking for a cure and you are ready to do anything for a cure from this diabetes because the doctors you consulted, they told it is not curable, it is only controllable. You are not able to accept that. Half-heartedly, you are going for another line, another approach, an alternate medicine. And this is being exploited by many people saying that they can cure the disease. If they don't cure, you are not going to ask them why you did not cure me as you promised. You just leave him. That is why another person will be waiting outside, like you, thinking that this person will cure. This is what is called exploitation of ignorance and unawareness, lack of awareness by our people. Finally, what happens? You lose your money and also health. You are spending money to lose your health. Finally, complications, renal failure, kidney failure, amputation, loss of eyesight, heart attack, and now you blame the disease for this outcome. You always blame the disease for all those things, but you forget how you were misguided with all these false promises. And one thing, the irony is, you don't know who spoiled your health. Too many doctors, too many advisors, all these people experimented on your health. Now, who is responsible for these complications? For your present suffering? Who is responsible for this dialysis? A loss of limb? You are not able to say who is responsible. Now you regret. I don't think you will be hurt if I say you are only to be blamed and you are responsible for this bad outcome. I'm sorry to say this. The world is like that. If you're if you're ready to get deceived, you'll be deceived. That's life. And everyone talks about this, and many claim they can cure this. Every doctor's aim is to cure people only. But only certain diseases can be cured. As I told you, infectious diseases can be cured. When there is one cause for one problem, it is easy to solve. Here, this is a disorder of lifestyle. Too many causes. So approach also too many approaches. And that is why many people talk, as I said. These causes, we don't call it as causes, as I told you. We call it as risk factors. Every factor contributes some percentage depending on the behavior of the patient and the lifestyle the patient lives. If you want me to enumerate some of the risk factors which are responsible for this diabetes, starting from family history, getting into a lifestyle which includes obesity, the nature of the job, a sedentary life, lack of exercise, of course, unhealthy food, eating habits, lack of knowledge and awareness, failure to do a periodical checkup to know whether I have it or I'm going to get it or I don't have it, at least at present. We are not doing it. When you are not doing this, again, what really you end up in a stress when you come to know a problem. Stress again is a risk factor for diabetes. And once you get diabetes, that diabetes itself causes you stressed. It becomes a cycle. Stress, diabetes, again stress because of diabetes. A cycle is formed. And all these risk factors contribute for the bad outcome or adverse outcome. Many of these factors can be changed, avoided, or at least modified. Certain factors cannot be modified. When I say family history, it depends upon your parents, your father and mother. You cannot change your father and mother. That family history cannot be modified or changed. Again, age. You cannot say, okay, I want to become, I am now 60 years, I want to become 40 years, I want to modify this risk factor, I want to go back. You think it's possible? Not at all possible. That is why we call this disease as a multifactorial disease, a web of causes. One factor is linked to another factor. The another factor is linked to yet another factor. All these factors are linked, and finally, we end up in diabetes. No doctor wants you to suffer lifelong. No doctor. What doctors do is to make you live a stress-free life, prevent the complications due to diabetes, or at least postpone the complications. Even many of the doctors are having this problem, and many of the family members of the doctor is also having this problem. So they know the sufferings. They know how you suffer because they also suffer. So definitely if there is a cure, the doctor who is treating you will go for a cure. And the same cure he will give it to you. Is it not a fact? Diabetes was once a rich man's disease, now it's everyone's disease. We all come to this world with all the organs. Why should we leave the world losing an organ? That too, which can be prevented. A preventable thing. Loss of organ, amputation, loss of eyesight. All these are preventable. Now tell me, because of your simple ignorance, you are losing your limb. All people here will advise you. They will give a lot of advices to you. How to avoid. I can cure. I got cured. Do this just 3 days. Press this place continuously 5 minutes every day. Eat this. It's a miracle drug. You will never and ever get diabetes. Who talks all those things? People who do not know what is diabetes. When you have a problem in your computer, you look for a person who is well versed in computer. But when you have a problem in your health, you believe everyone. You go to many people. Everybody talks and everybody says. All people will advise you. But remember, when they have a problem, we know where they come or where they go. No one should die of diabetes. After all, It is just an extra sugar in the circulating blood. Think like that, which is a fact. When we have a weapon to fight back this menace, why don't we use it? This is not a disease to be scared of. No need to worry about diabetes. Let us see why I say so. Yeah, now I can read your mind. This man is not having diabetes mellitus. That is why he is talking like that. Of course, I too have a family history, but till now I don't have that problem. And we too have lost lives because of ignorance. What I do is I do a periodical checkup to know my status. Sometimes I may even cross that particular border. Immediately I will do some changes, my habits, food habits. And after continuing that for some time, I repeat that. I come back to normal. So there is a proof in me. I am the proof in which and the changes worked. What all I said is not a false thing. What all I said is some of the fact. I just highlighted the ignorance of people and how you people follow, pray for these false promises. Please don't try. If they say I can cure it, do one thing, give them some time, not years. Give them 1 or 2 months or 3 months or 4 months. If they do not cure you, you have all the right to question these people. Remember this. So with all this, in my next video, I will explain why diabetes is not a killer disease. Can we do that? Till then, thank you. See you again.